Hi, everyone. I'd like to do a shout out to our sponsor, Baco Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Baco Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of their clients, Baco Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the position. Baco Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Baco Diagnostics services, get started today by sending an email to corporaterelations@bacodiagnostics.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and co-host for the Dean's Chat podcast. Once again, I'm with my co-host, Dr. Joanna Richey. Hello, Joe.
Hey, Jeff. How you doing?
I'm doing great. Kind of looking forward to the holiday season.
I know, it's incredible. I can't even really wrap my head that we're actually here. But we're here.
It's fabulous. Well, Joe, we have a phenomenal guest today. I'd like to introduce a student from the Arizona College of Podiatric Medicine, fourth-year student, Luke Seuffer. Luke, welcome to Dean's Chat.
Great to be on with you guys.
So, Luke, I was sharing with you earlier, usually, we catch students, right after boards or, after they've done match, and you were kind enough to come on right in the middle of doing all of your clerkships. So thank you for doing that. And I know you've been traveling around the country. We'll get to talk a little bit about that. But I thought I'd give you a more formal introduction, if you will. You and I both graduated from the University of Wisconsin-Oshkosh. And Joe, I remember yesterday recruiting Luke to the Arizona College. I'm like, this is a first for us down here from Oshkosh. So Luke, you got big shoes to fill here. So after graduating from Oshkosh with a biology degree and chemistry, you did a biomedical sciences program down at Rosalind Franklin in Chicago. Then you came down to the Arizona College. There's a little shift in gears in terms of weather, that's for sure. But we can certainly talk about all that, and we have a whole list of things to talk about. So once again, thank you so much for joining us.
Yeah, absolutely. I'm looking forward to our discussion.
And I'd love to kick it off first, Luke. You were one of the first students that I met when I started here at Midwestern. Can you tell us a little bit about how you found podiatry and how this whole journey started for you?
Yeah, so my whole introduction to medicine, I didn't grow up with no one in my family is a doctor or anything like that. But my mom is a nurse. She's an RN, and she worked in labor and delivery for probably about 30 years. So I kind of had a close look at that growing up. And so I had that exposure, but I didn't really know what I wanted to do when I left high school. All I knew is I was good at school, and I had some scholarships coming my way. I was like, okay, well, let's go off to college. Let's kind of try to figure this thing out, figure out what I'm going to do with my life. It's a pretty big question. But yeah, so I got to college, and I grew up going to church, and I had a mentor. His name's Dr. Alan Last, and he was actually a family medicine residency director in Appleton, Wisconsin. And he had a great influence on me. And as I was sort of figuring out my path in college, he encouraged me to consider medicine, and specifically to consider family medicine. So that was my initial pursuit in college. The idea of going into traditional medical school, kind of seeking out family medicine, being well-rounded, serving a lot of different patients with a lot of different conditions. That was kind of where things started. My job as a pharmacy technician, I took on during my third year of school. So I was kind of looking for, a job that would kind of get me in the door of, the medical field, and was looking at some different options. And, there was a position at a pharmacy on the way to school, on the way to Oshkosh. So I was like, it's perfect. It's right there. I'll get exposure to a lot of different drugs and, main corridor within, the medical sort of system, right? A pharmacy and the dispensing of medications and treating patients that way. So that was my introduction, or kind of how I started to work towards medicine. And then after I graduated, I had a couple gap years. I was getting experience. I took a job as a medical scribe, still held on to the pharmacy job. So I was doing that. And then I decided to pursue the biomedical sciences program at Rosalind Franklin, or otherwise for us, the Scholl Podiatry School. And so while I was there, that's where I was introduced to podiatry. I was kind of in the season of which route am I going to go? Am I going to go down the traditional medical school route, or am I going to go down this podiatry route that I was exposed to? So that was kind of how I was introduced to podiatry, and there's a lot more that I could say about specialty versus general practice. But I really feel like I found a home here in medicine, in podiatry, and that, I wrote about that actually in my residency application.
That's outstanding. And, it's always fun to figure out like where these little connection dots are. And, there are different programs on different campuses, and sometimes just being a little bit exposed, like, what is this podiatry thing? So, I'm curious. Sorry, Jeff, to piggyback on that. So you were in Chicago. What drove you to Arizona? Obviously very different. We don't get much of that cold white stuff that falls from the sky over here. So what brought you to Arizona?
Well, so I cast a broad net when I was looking at podiatry schools, but specifically when it came to Arizona, there were just a number of connections. So Dr. Jensen being from Wisconsin, and being from Oshkosh, a lot of different relatable things there. My friend Alicia, who's a classmate of mine, she was also in the biomedical sciences program and had previously committed to Arizona, so I knew she would be there. I have a second cousin who lives down in Gilbert, so less than an hour. So we reconnected with me going out there. And then I'll mention two other things. There's a direct flight from the airport that's closest to my parents to Mesa. I was like, you can't beat that. And
It's
then
incredible. Yeah.
yeah. And then just, I don't know, I kind of wanted to check out something new. Arizona is kind of known, right, for the Grand Canyon. And I was just like, let's just go check it out. Like, go taste this adventure, step into this new, like, season of life. And so, I don't know, for me, it didn't really matter so much where exactly I was going. But knowing that I would get really solid training, and that's something that definitely came through, is Midwestern is a very, very solid training program. So lots of reasons.
That's interesting, Luke, because when we interview students, oftentimes they're from all over the country, and it's a long trip from the East Coast to Phoenix. So I think I probably told you this: once you get on an airplane, it doesn't matter as long as you get a direct flight somewhere, right? So
Right.
I've said that a lot over the years. So I have a question for you. How did the biomedical sciences program prepare you for the curriculum?
Yeah, so I think it really gave me a taste of the caliber of training, or just the pace of classes. So it was very similar to sort of like some of the things of our first year, where I was in biochemistry. Particularly, it's been a while since I've thought about the class load that I was in while I was in Chicago. So I'm kind of struggling to pull those back up to the top. But it really was kind of this transformation of studying, of like, okay, there's a lot more volume and I need to focus on getting through that volume, and kind of my introduction to Anki, which is a kind of one of these electronic flashcard apps. So kind of used it on and off, and every student kind of finds their niche in terms of what they feel like works for them and what they feel like they have time for, or just how they remember things. Everyone's so different. But that's kind of where I got the taste of that. And then when I decided to go down the podiatry route, I was like, okay, like all of these things are still relevant. So those were kind of a few things that I picked up while I was in that program.
So interesting, because whenever we talk to students about boards, they take the same classes, they have the same class notes, but some students will use Anki decks for one course for studying for boards or first aid or sketchy or whatever it might be. And to
Right.
your point, Luke, is so individualized to what works for one student compared to another. So the earlier you can find that out, right, what works for you, the better. So just a shout out to the biomedical sciences program, and we've got a tremendous program here in Arizona and Downers Grove. The students that go through those come in with a leg up for sure because they've already kind of figured out how they learn best. So
Yeah.
kudos to you. How many of those flights did you take back and forth to Wisconsin over the last few years?
I've stopped counting. Like this year, um, th- let's see, probably at least 10. Like
Yeah, okay.
just, yeah, going back and forth between breaks. Yeah,
Yeah.
just going back. It's changed a lot now that I've gotten married. Um, I find that I stay more in, during third year, staying in Arizona, um, or just flying back to Arizona as opposed to going home to see, see like my parents and my siblings. So,
Yep,
yeah.
absolutely. No, that's fantastic. Joe, your thoughts as we transition into like clerkships and things.
Yeah, before we leave some of the school stuff, if you were to give a student who's interested in something healthcare, but they haven't been able to put their finger on exactly what it is, knowing what you know now, what would you tell them in their process of figuring out that? I love how you phrased it, like
Yeah.
figure out this journey of like, what do I want to do with my life? Like, how do I answer these questions? So what kind of advice would you give them?
Well, so I think a big thing as I think about specifically the difference between like pharmacy and being like a clinician, or like there's different paths you can go down, right? So you kind of have to think about the sphere within medicine that you want to be within. I think you really need to answer the question of whether you want to be sitting in front of patients or not very early on. And obviously that's something that can change and that can be something that's very dynamic. But for me, that's something that I knew I always wanted to do. I wanted to be the person sitting in front of the patient, assessing the problem, trying to figure out what's going on and building that personal connection with them. Because that's just relationships are something that I think are really important and they're they're life-giving in a lot of ways. And so not only am I looking to, right, support someone in their health and help them get better and just optimize, the function that they have, thinking about the foot and like biomechanics, um, but really thinking about them as a person and, thinking about their lifestyle and just relating them to them as a person. Um, so that's how I found that I wanted to be a kind of like a clinician sitting in front of patients. You could be someone that wants to teach. So kind of what you guys do where, you're upfront, you're talking to students, or you're going to conferences and you're lecturing. That's a big aspect too. People just, I think there's different interests. Some people are really interested in medications and pharmacology. Some people really want to get into research. Some people really want to lecture and teach. And some people really want to care for patients. And so I think there's um, a broad field to choose from. And I honestly think we have the best of both worlds in what we do because I remember as a third year student in my first rotation with Dr. Jepson down in Queen Creek, my first experience of stepping into an OR. An OR was not some place that I like necessarily envisioned myself like pursuing family medicine. But I remember my first time stepping in there and right, there's all the nerves and you're like, don't touch anything, like get your gloves, get your gown, and just don't do anything dumb. And um yeah, just the excitement. And so I think it's really cool. So specifically within podiatry, and this is a bit of what I talk about in my residency application, is that we really get the practical aspect of like we can offer like assuming all of our conservative approaches have failed for a patient, we can take them to surgery and we can be like, okay, here's this skill that I have. Here's this thing that I can do to help correct, the structure or the function of your foot so that you can walk normally, and you can get around. And I think that's so cool that we can do that. And so we're not strictly like clinical, sitting at, as much as I value that. And so I really value the practical aspect, and the hands-on skills that we bring.
Oh, I can definitely mirror that. That was my biggest concern when I was a student trying to figure out what I wanted to do with my own life was just being bored. Like I was so afraid of like being an adult and like sitting in an office and just dreading like watching the clock, and I can gratefully say I would welcome some boredom sometimes now, but that flexibility of being able to, exactly to your point, see patients in clinic, be in the operating room, do research if you want. Like there are opportunities to engage in a lot of different ways, a lot of different pathways through podiatry. So thank you for sharing that.
Yeah.
You were so eloquent in describing that first OR experience. I was having flashbacks to when I was a student in California, having that same exact feeling. Like I'm here, I want to be productive, but I don't want to screw anything up. Right?
Yeah.
So,
Can I tell you my
Yeah.
hilarious
everybody goes
first
through.
OR? Sorry,
Yeah,
Jeff.
yeah, go for it.
So same thing, Luke. I was so nervous and it was like, don't touch anything. So what do? Right? I'm like all scrubbed in. I put my hands behind my back. The worst thing to do. But again, and everyone's like, don't move. And then I was like, well, I've already screwed it up. So at this point, I can only dig myself out of the hole. And luckily the attending was incredibly gracious and she did not like berate me or anything. She was just like, yeah, you just need to redo it. Like your back's not sterile. So
Yeah.
put your hands on something blue and don't touch anything.
Yeah. And that's also something that I remember is just like, he was just like, put your hands here and don't move.
Well,
Yeah.
it's so funny because that wasn't that long ago, Luke. I mean, you're
No.
halfway through your fourth year now. And it's amazing how the training process is structured such that, you go from sitting in a chair, studying, taking exams, rinse and repeat, rinse and repeat. Next thing you know,
Yeah.
you're off on rotations and it's just incredible. It's like systems overload. So tell us a little bit about the third year and then as you transitioned into doing clerkships outside of the Arizona area.
Yeah. So, there's so much to talk about and there's so much that's happened. So third year, I feel like, so we have our clerkships that we start going into or our rotations. I don't know the proper way. Like I'll just call them rotations. Um, but yeah, so like, do you want me to go into like who I had during which month and like kind of what I took away from it or?
No, I just, the experience of the third year in
Okay.
general,
Yeah.
leading up to what we officially call clerkships, where you're going out for those month rotations to other hospitals.
Gotcha. Yeah, so it is kind of, as you were saying, that transition from sitting and taking tests to going and doing things. It it is a transition and it does take time to kind of, start pulling these things in that you've learned. So yeah, like you'll go into the clinic in October and you're just, it's kind of like the OR experience. You're kind of tentative. You're like, oh, like do I know anything? Like, am I going to mess anything up? And you're just kind of trying to get the flow of things down. Um, and you're trying to remember all of the little tests and the little skills that you've learned, like in your physical exam. And then kind of at the same time, you're trying to, present things in a logical way so that you're not kind of, washing back and forth and jumping to your physical exam and then going back to your history and then saying, oh, I think they have this, or maybe we should do this. So it's kind of a little bit of trial and error. And you definitely get a lot of guidance from your preceptors. But overall, I think it's really great. And I think we have a good set of rotations leading into fourth year. I would say for me, I felt probably comfortable like after probably like 2.5 months in, so probably like halfway through December, I felt like I was all hands on deck. Um, January was like my medicine rotation, so I was with endocrinology. So that was a little bit different, kind of back to sitting and taking notes and seeing what endocrinology does. I especially thought that my February rotation at the Phoenix VA was valuable. Um, just because I had not been in a hospital setting until that point. And so the experience of going and rounding and just seeing patients with different conditions and, preparing for the resident and for the attending to come around, I think that was a really valuable experience because not only is that very practical to fourth year because, you're doing that a fair bit. But I had never done that. So I saw a lot of value in that. And then my final month, before I took off. So April was my first month out and I got to depart and I didn't have to come back to Arizona. It was actually at the Midwestern clinic with Dr. Kraleski and Dr. Richey and Dr. High Rosen. So it was a very good experience. And I think there are a lot of ways that we were prepared well for fourth year. I think the only thing that was maybe a little different is that there were some higher expectations as a fourth year. So just making sure that you show up early, these soft skills that you talk about, things that, you don't have to have any talent to do well, like show up early, be attentive, read the night before, be prepared. And then just being helpful, being able to read the room, being in a procedure and being like, okay, what's the next step? What do they want next? And just being able to kind of predict that or to have it ready for them. I think those are really valuable skills for students to learn. And so I do think there was probably like month and a half that was kind of like a learning curve because the expectations between third year and fourth year kind of shift. But then once you get the hang of that, and once you figure out kind of how to put your presentations together in a really good way, I think you're really tooled up to do fourth year really well. And so that was my experience, and it's just been fun. Yeah.
So I'm interested now transitioning into, well, two things first. One is you had a little baptism by fire because Dr. Jeppesen, that's like going into a
Absolutely. Yeah. He's definitely really high caliber. We'd come into clinic, and he'd pull up some x-rays of, a patient that he'd had. And, he'd be like, what's the calcaneal inclination angle normal? And we're like, am I going to remember this? Like, so there was definitely a high level there, but I feel like that's where, like, I sort of have this love-hate relationship with rigorous questioning, because on one hand, like, you get it wrong, you're like, oh, I'm a horrible human being. But then, like, it's also this, it's a test, you get to see, okay, how much do I know? Like, what is my thinking? So kind of pulling these things together. And it's like a little challenge, and it's kind of fun in that way. So yeah, he definitely carried an aspect of that in his rotation. But I think I'd probably say he might be my top rotation of third year as far as like my favorite.
Well, the second point I was going to make is it's a process, right? I mean, there's a reason you have to spend time in clinics and interfacing with different clinicians. And we always love it when you get to do an opportunity to rotate in our home clinics with our docs. Joe, what are your thoughts on that transition over time? I mean, it doesn't happen overnight, but it's like a major conveyor belt or something that isn't so needed, but it's very predictable too from our perspective.
Yeah, and I think that this is also where like designing curriculum starts to come in, because I know a faculty member that may have talked about the importance of a calcaneal inclination angle on several occasions, perhaps.
Perhaps.
But this is the reality, right? Like, until you start to have true opportunities to continue to apply that information, it doesn't, like, the value of it as a student gets a little bit lost. But once you start to have those opportunities to engage with it, with also someone that you don't know, right? Because I can absolutely appreciate engaging with the faculty that you do know, that hopefully aren't as intimidating as this other person that you don't really know and, comes in with high expectations. It just puts a new perspective into it. And then you, as you said, Luke, then you really get to have that moment of like, I know that I knew this, but I can't remember it right now. And it starts to like prioritize things that really are important, or common things being common. And you go out on another month, and as you said, you get to see it in another way, or you start to apply it in a different, maybe case-based scenario or something different. And it really starts to bring these things holistically in. And so I think that this is the other part about learning, that we can't accelerate. There are some things in the process of learning that have to happen. And as much as we are getting accustomed to condensing and amplifying and using leverage technology to improve things, there are some things that just cannot be expedited. And learning is in a systematic and progressive sequential way. There are just, you need these different touch points to start to really cohesively wrap all this together. And that's something, in fairness, that I definitely did not appreciate until, honestly, being able to teach students in a classroom and a clinical setting. Because even at previous schools, when I would teach academically, they didn't rotate through my clinic until they were externs. So they had already gone through like clinical rotations. They had already gone through a whole different level of processing, if you will, prior to coming as an extern at a program. But there's a big difference between a third year and a fourth year in terms of not only, to your point, Luke, what the expectation is, but even the processing of the information. And so I love that the curriculum is designed in such a way that you can't apply knowledge you don't have. So you have to sit in a classroom, you have to learn the facts, then you have to start to apply them in these situations that are progressive, case-based, maybe lab-based. And then you have to go see it in a real life context. You need to be in a hospital and see a patient with kidney disease and how that impact, like, all of these different pieces of your training start to come full circle. And I distinctly remember being a student, and I was with a preceptor, and they were like, we were getting ready to walk in the patient room, and he was like, I already know, just based off of, these few things in my medical assistant, what this is. And I remember being blown away. Like, how could you already know? Right. But that's also the part of the expertise that starts to come in. You see something over and over again, you start to get comfortable with what that is. And as a student, then you get the opportunity to engage with what else could it be, and going down the differential diagnosis. But all of these layered experiences are really what help you get to that point of expertise that, again, you can't chat GPT that.
Yeah,
right?
no, by no means, like, chat, no offense to chat, but like it does not know podiatry very well.
Well, and that's, if you
Yeah,
can prompt it, it can do a good job, right?
yeah,
But
yeah,
exactly to your point, it can't expedite the learning process. And this is where I think it's really fun, is to figure out, okay, so how do we leverage it to improve outcomes, but not, oh, I said this the other day much more eloquently, Jeff, not outsource our thinking to it or something like that. But
yeah, absolutely. So speaking of AI, one of the tools that I have found to be so useful is open evidence. Like, you can ask it a specific question, and then it just spits you back some articles, and it's like, all right, let me go read some of these. And just, I remember, so September for our clerkships this year was a 5-week month. And I took my 4th week of that, and I went and visited the University of Cincinnati, which is my February rotation, because I wanted to see them before interviews. And I remember I was in clinic with one of the main attendings, and we were talking about, when do you do ADIs on a diabetic patient? And, there's a classic answer that you need to know. It's like, okay, if they're greater than 50, and obviously if they have any other like predisposing factors, peripheral arterial disease, if they're a smoker, some of these things. And, she asked me that question. I was like, I haven't looked at that in a second. So I went and I found the answer, but then Open Evidence also provided this article where it's like, oh, maybe we should be doing this at the point of diagnosis. And I went and I read it, and the my criticism of the paper is that I think there were too many confounding factors, and their date, like their sorry, not their date, the age of their patient groups was not different enough in my estimation. And so I think that's where AI can be really useful. It can help you um, start to put hands and feet on a question and kind of figure out, what is the answer to this. But then it also allows you to use your brain and to, have these discussions that I think you tried to prepare us for with journal clubs, and just be like, okay, like who wrote this? What is the data saying? And just doing your due diligence, I think, is how I would say it. Because you don't want to be like hypercritical. You want to take the things that are worth it. Don't throw out the baby with the bathwater. You want to preserve those good data points, and you want to learn from those, and you want to internalize those so that you can build those into your future, like decision making and thinking. Um, so I've appreciated using open evidence. I tend not to use ChatGPT very much anymore.
Why don't we just take a minute and hear from our sponsors? We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet. All right, we're back. Always good to talk about Bako Diagnostics. They're just a tremendous sponsor. So Luke, I have a question for you. When I was over at the clinic and when you were in your month rotation there, you and I had a sidebar conversation because you had just competed in a chess tournament.
That's right.
And I'm very curious because I loved playing chess when I was younger. I haven't played it a lot as an adult other than teaching my kids how to play. But tell us about your chess competitions, how you got into it, how you get better. I'm sure a lot of our audience are like me. They don't know that much about it.
Yeah. Well, so I learned chess at a very young age. I don't remember exactly how old I was, but I learned it from my parents. And then we always had a board around, but like it's a hard game, and like no one ever really wanted to play it. They'd rather play cards, or, just rather play something else. I think there was a big draw when the Queen's Gambit TV show came out on Netflix, kind of back around COVID, and I think that drew me back a little bit. So like I dug out my parents' board and I started playing more. But funny enough, when I actually moved to Arizona and I was in my first apartment as a first year, my roommate was Isaac Ballieu. He's a second year resident now at Denver Health. But he was really into watching Gotham Chess, which is probably the biggest like streamer when it comes to chess or just chess content creation. Like he's a huge name. You could go and look him up. He posts videos like every day. It's crazy. But he really liked watching his videos, so we would sit and watch them like, over like lunch or something like that. And he also Isaac liked to play chess as well. So like I brought my chessboard with me, of course. And so we would play a lot of games, and we were pretty equally matched. I would say we were both probably around like 1,000 ELO rating, which is ELO is kind of hard to explain to someone outside of the chess community who doesn't already know what it is. It's kind of like your relative rating of how good you are. So I would say like it's so hard to figure out like, okay, what's normal, or what's um what would an average person be, because there's so much variation. But that's something that Gotham Chess does, is he has a YouTube channel that's called Guess the Elo, where he'll have people submit games, and then based off of how they play, moves that they make, moves that they don't make, he'll try to guess what their rating is. And then it's like this reveal, and how close was he off, and just his commentary is really funny. But there's a lot of reasons why I appreciate chess. So let me backtrack a little bit. So I've only played one competition so far. I played, I think it was like the monthly Swiss tournament. There's like a chess club. I think it's close to Scottsdale. But I had just played that. I think it was during the month between February and March. So it was before I started at the Midwestern clinic. Um, but it was such a humbling experience. Like you go in there and there's a bunch of like 9 and 10-year-olds and they're crazy good. Like these people were like 1,500. And for me, my online chess rating was probably around like 12, probably like 1,200 at that time. But there's a difference between your online rating and like your over the board rating, as we say, like over the board being in person play.
Right.
And I lost 3 games and then I won my last one, against a guy who was somewhere, I think he was like 989. Um, but that felt really good because it was so in chess, right? You have openings, you have a middle game, and you have an end game. And I've been thinking about this a lot because as I was preparing to come on here, I was like, well, what do I want to say about chess in terms of the parallels, or why do I appreciate it as a game? I appreciate chess because it's not a game of chance. It's not like rolling a dice or playing cards where there's some randomness. Like you have to make decisions, and what you decide to do at different points in the game affect how it unfolds and how it looks. So when I think about, to just kind of draw some parallels, um, if you were to talk about openings, you could kind of think about that like the night before surgery, like your preparation. Because in opening, right, you learn in opening, you learn so many moves. Like you can learn 10, 15, sometimes like 20, 25 moves. Like it's crazy the depth, and you have to memorize it and you have to know it. And if this person, plays this move, I played this move. Like, and you study all of this with engines nowadays. You used to do it with books. You can still do it with books, and you can study you can study grandmaster games, or just legendary games, like world champions have played. Um, so that I would kind of compare that to like your pre-op workup or your pre-op preparation, because um, you don't necessarily win in the opening, but you can lose. And so I think how you work up a patient, how thorough you are, the things that you're mindful of, and how much you read and make sure that you're prepared for the surgery that you're walking into. You know, if you don't prepare, you set yourself up to not be successful. But if you prepare well, just as you do for a chess game and how much you study your openings, you can set yourself up for great bounds of success. Um, I think I would compare a middle game to kind of intra-op, or like a clinical visit, as you're evaluating what's going on, and that is how you refer to it. You're evaluating, you're calculating, you're trying to figure out what's going on in this position, right? And this is something that Gotham talks about, where when a piece moves, you have to remember, what was it doing, and now that it's moved, what is it not doing? Because that it's so important, right? Because if you push a pawn forward and there's a bishop behind it, well, you just opened up the light of the line of sight of that bishop, and it's staring across the board, and it's ready to take a rook, or it's ready to take a piece. And so you constantly have to be thinking about these things of like, when I move this, how is that going to change the board? And so not only do you have to do it for yourself, but you also have to do it for the other player, because right, checkmate is always looming, and you can be ahead, but like if someone throws a knockout punch, they can find checkmate, and then you can lose. And it's like, you shouldn't have lost that game, but you did. And so I think there's also an aspect of humility, of just chess is very humbling. It's a hard game. And I think that's that's kind of what my experience was between third year and fourth year, is like, it's humbling. You're trying to get oriented. You're trying to figure out how to put these pieces together, how everything flows. And then once you start to develop that, as you develop your chess game, you get better, and you see better results, and it's fun, it's exciting, and yeah, I really enjoy it.
Lots of parallels. Joe, your thoughts?
Yeah.
I can see that.
Yeah, no, I like that you pointed out a couple things, and also full disclaimer, not a chess player, but this idea that it's not a game of chance, because those were some of the things too that I had thought about, Luke, in preparation for today, is there are very distinct decisions that then have ramifications, and you're almost managing risk throughout the whole game.
Yes.
And all we
Yes.
do as surgeons or clinicians is help patients manage their own risk. There is skill, and there is preparing, and there is knowledge and expertise, but nothing is guaranteeable. And exactly as you said, once you start making moves in one direction, you have set that course in action, and you don't get to go backwards from there. And again, I think those are some interesting and fun parallels. And yes, perhaps my chess knowledge came from the Queen's Gambit. I might be in that group of people. I tried to have my 9-year-old daughter teach me how to play, and she just totally blew me out of the water. So it's just not as much fun, because she loves getting to beat me. And in fairness, like, she just toasts me. Like, she's not teaching me. She's just enjoying the massacre. So yeah, I'll have to find somebody that is more patient.
Yeah.
Teaching.
And that's very correct. Like, you push a pawn, pawns
Yeah.
do not go backwards. They
Yeah.
can't. Like, a horse can go backwards, a bishop can go backwards, a rook can go backwards, the queen, the king, all of those pieces can go back, but you lose time. So time is also an important aspect of, like, how many moves, like, that's something that gets talked about, of, like, do you have time to make this move, or not? And so that's at risk evaluation. That's all. It's all in the language of how you talk about chess at a high level. And I think one of the cool things is that it very much is part of the conversation. I'll watch a high level game, like the World Cup just finished not too long ago. That is a major tournament where the top 3 finishers place into the candidates, and the candidates tournament is what determines who the next world champion challenger is. So whoever wins the candidates then gets to go on and play games against the current world champion. So right now that's Gukesh D. It's the youngest world champion we've ever had. He's 18 year old. Well, he was 18 years old when he achieved it. But yeah, there's tons of risk, and sometimes you have to take risks, like at a high level, in order to win. And so maybe in some ways that's applicable. Sometimes there's a really radical surgical procedure that you have to offer a patient. Like, so I'll think of a recent case that I did my presentation on this month. We had a diabetic patient, long time known to the doctor that I was working with, and he had a midfoot like Charcot event, and it drifted lateral, and that had calmed down. Went into his initial external fixation. He walked on it. Went to his second external fixation. Walked on that, and so compliance was just a nightmare. So we ended up doing an anterior plate ankle arthrodesis, like a TTC arthrodesis. So he had a nail previously, an intramedullary nail, and walked all over it. I think he may have broke it or something happened, but just not very much of a tail is left. But yeah, a lot of complication, a lot of risk, and I remember being in that surgery and then coming in and putting that patient in a cast, to protect that construct and give it time to calm down. And so I think the whole discussion of risk and what do you do, I think it's something that very much it's good to start thinking that way as a 4th-year student, because you're going to be doing that as a resident. You're going to be doing that as, as an attending, and, whatever you decide to do with your career, whether you're in a hospital or private practice, you're going to be managing risk all the time. And so thinking about that is a really important thing.
Love it.
I do too. That's so good. So Luke, not only do you use your mental capacity playing chess, but you and I have gone out and shot a few targets. Your hand-eye coordination is also excellent.
Thank you.
No,
Yes.
that's fun. All
Yeah.
right. Joe, you want to do a couple quick rapid fires?
Absolutely.
All right. So kind of leading into that. How'd you meet your wife? You met her while you were in school here. Not
Yeah.
really
So
rapid fire, but kind of, sort of.
yeah, kind of, sort of. We met on an app. We met on Hinge. And it's interesting that it worked out because we didn't think that we were the type of people that would end up together. But it's really beautifully come together. And I think of myself as like, I'm the busybody. I'm always go, 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 do this, do that. And she's kind of like the calm that counteracts that. So like when I'm home or we're spending time together, she reminds me, hey, slow down. There is life to enjoy and let's enjoy this time together. So
That's
yeah, that's how we met.
that's fabulous. Congratulations, by the way.
Thank you.
All right, Joe.
Okay, I'm going to piggyback off of that one then, because you had said something that I thought was incredibly reflective and really good life advice, not just in this situation, but not to get super personal, but you got married and then had to go on your rotations. So, what do you feel like you guys have really? This is challenging, right? People that have families and they're gone on externships. What have you taken out of this experience so far, Luke?
I would say communication. There's just a lot of intentional communication that has to take place. It's like I'm across the country. So there's a difference in time zones. And so she knows I'm busy, but we talk on the phone every day. So sometimes 2, 3, 4, 5, it just kind of depends what's going on. So communication is definitely one thing. Um, the value of time, kind of like we were talking about a little bit before, of just really appreciating the time that we have together. And I think part of that goes towards structure, of just structuring your time, using your time well. Um, Patience, definitely. Um, yeah, whether, it's a disagreement that we have, you know, we're always committed to one another, and I think that's the frustration, but also the beauty of marriage. Of, you have this other person, they're different from you, they take a different approach, and you're not always going to agree. And knowing, like, I think that's a big thing for us within the first year, of like everything's so fresh and so new that there still could be lingering thoughts of like, is this going to work? And there's so much change and adjustment as you continue to get to know each other and just really do life with each other on a daily basis. Um, just being like, okay, we might disagree on this, but that's okay because we are committed to each other. And I think that's the beautiful aspect of marriage. So there's a whole lot that I could say, but yeah, I don't want to take too much time.
I think those are three really excellent ones: communication, the value of time, and patience. I'm still learning those. So I thought that was, again, being a fourth year student and already taking some of those kinds of lessons to heart, I think were outstanding. So
Yeah.
This one's a
not
little
really
light.
rapid fire, but
Yeah,
No,
this one's more lighthearted. So yesterday,
yeah.
Luke, you and I were texting during the Packer game. They won. They're looking pretty good. What this episode, by the way, is going to go out right around 4 weeks, 5 weeks from now. What's the
yeah.
destiny of the Packers this year?
Oh man,
Ooh.
that's the $1 million question, because the NFC North is stacked.
Yep.
I think the Vikings are maybe falling off a little bit. Chicago is surprisingly good. Like, they haven't been this good in years. So I think it's interesting that the schedule has been backloaded, where like we're playing both the Bears games like 2 weeks apart. Like, I don't know if that's ever happened before in my lifetime. But I think Green Bay has got some bright lights ahead of it. Like, I think we can go deep into the playoffs.
Tom Brady said yesterday they're prepping for January. I like that kind of thought.
Oh yeah.
And Joe, we don't want to leave you out of the discussion. Your Arizona Cardinals are a little challenged.
You can leave me out.
Okay.
Let's just not.
All right. Well,
circle back in a year and we'll see.
all right.
Maybe.
That sounds good. Joe, any last words on your end?
No, thank you so much, Luke, for the willingness to come on in the middle of a very busy clinical schedule and just share some of the things that you've learned and your experiences with us. We really appreciate your time and look forward to continuing to watch your career.
Yeah, and I appreciate you guys, everything you guys have taught me, and yeah, thanks for having me on.
Well, Luke, we're going to send you one of these Dean's Chat mugs that you can do your beverage of choice to keep you going through the fourth year rotations and boards prep and everything. So again, we thank you. And we also thank our audience and our listeners. If you're listening on Apple or Spotify, please give us a 5-star rating. And of course, if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in the profession, and in Luke's case, future leaders in the profession. And keep up that chess game there, Luke. There's a lot of potential there.
Oh, yeah. I'm excited for it.
All right. Sounds good. All right. Cheers, everybody. Bye-bye.
Bye-bye.
Thank you.